Greetings. We are from the QT School of Design and QT Design Lab, and today we are discussing the topic of sustainability and design for healthcare. I am Marianella Chamorro-Koc, and I am a professor in industrial design. And with me is
Zoe Mellick from Fashion Design.
We would like to frame our presentation and discussion around the question, how might we address sustainability in healthcare innovation? For this, we're going to refer to healthcare services in Australia. With a focus on safety and quality of care, in 2022, the Australian Commission on Safety and Quality in Healthcare in Australia reviewed policy, practices, and research affecting healthcare services and identified the need to action sustainability practices across the sector to meet the challenges of the future. The review found that around a third of all Australian hospitals are part of the Global Green and Healthy Hospitals Network and are actively working on a range of more than 10 sustainability goals. These are buildings, energy waste, leadership, procurement, transportation, food, chemicals, pharmaceuticals, and water. These areas present opportunities for a diverse range of design interventions. Most identified interventions in current hospital practices were in the areas of life cycle, assessment, waste, and reductions in carbon footprints through the use of telehealth. Connecting design, healthcare, and sustainability, here we're going to talk about two case studies as opportunities for design interventions. Over to Zoe.
Thanks, Marianella. So the first case study we're going to look at are hospital uniforms, and we know that hospital uniforms are an essential part of the healthcare environment. QUT's Design Lab was involved in a student-led project which aimed to improve uniforms at 2 Australian hospitals. The project involved designing prototypes based on feedback from healthcare workers and patients. The surveys revealed preferences for comfortable, practical scrubs with better sizing options and better identification. The prototypes featured adjustable sizing, breathable materials, and visible ID tags. Now, this project was done pre-COVID and also didn't look at sustainability issues in the manufacturing and use of uniforms. So we'll take a look now at some of the ways these elements could be included. So the life cycle of medical uniforms impacts the environment significantly. They're usually made from synthetic fibers like polyester or natural fibers like cotton, and they're often blended together. We know that cotton requires pesticides and water, and polyester depends on fossil fuels and produces microplastics. Now, textile production uses energy and water and also creates textile waste. Distribution adds packaging waste and also energy use. Uniforms need frequent high-temperature washing, consuming more energy and water. And recycling blended fibers is hard. So most uniforms end up in landfills. And we know that polyester takes decades to decompose while cotton breaks down faster. So some ideas for making medical uniforms more sustainable include avoiding blended fibers and using single fibers for easier recycling, reducing textile waste with zero waste designs, making uniforms adjustable for better fit and longer use, localizing production where possible to reduce transportation emissions, adding repair features like replaceable pockets to extend wear, and designing uniforms for easy disassembly, for reuse, and for recycling. As you can see, these strategies address 6 of the goals, so chemicals, water, procurement, workforce, energy, and waste. I'll now hand back over to Marianella to discuss PPE.
Thank you, Zoe. So this is our case study number 2, and it's about facial masks or PPEs. And you may remember during the global pandemic, we all have to use this facial mask. And QT Design Lab worked with hospitals and clinicians on the design of a child-friendly PPE for pediatric care. This project departed from the pediatricians who reported the challenges and barriers presented by the use of facial PPE when working with children. Facial masks limit their ability to build rapport, communicate effectively, demonstrate, have comfort and or comfort a distressed parent or child. Our design research involved observations, surveys, interviews, simulations in different pediatric scenarios of care, co-designing and prototyping with the stakeholders. One of the aspects highlighted by clinicians was the concern about the huge waste being created by single-use masks. And you will see the figures in this photo explains the amount of landfill and environmental pollution created by single-use masks. And it is a problem that still has not been resolved. In this image, you can see the illustration of the different parts of the problem. N95 and KN95 are the facial masks that we commonly use. And these have 3 to 5 different layers made from petroleum-based and non-renewable polymer. The disposal created massive environmental pollution due to the material, the buried waste, and waste incineration. Following the sustainability life cycle diagram that we use for the case of the uniforms, here we can identify the sustainability issues in the case of facial masks or PPEs. For this, we suggest some ideas of how we could make facial PPEs more sustainable. First, we could develop and design biodegradable masks, for example, using banana stem fibers. Second, we could design disposable PPEs by considering the materials, their design for assembly and disassembly, their reuse, recycling, and their end of life. Third, we could increase awareness about environmental impacts through education. Fourth, we could develop policies and regulations. For example, the Green Hospital Initiative and working more on the life cycle management of these masks. And fifth, we could develop environmentally safe disposal methods, such as disassembling to dispose correctly and recycling into new materials.
So in summary, these 2 case studies amount to addressing 6 of the goals, and design thinking opportunities could focus on education and training, or the design of uniforms and PPE, or research on recycling pathways and use, manufacturing, and material selection. We can then look at policies and protocols to support these.
So to conclude, here are our takeaways. In the case of the case number 1, the uniforms, I think that personalization and choice in terms of highly customizable and look at personalization as a way to make it more sustainable is a way to consider potential design interventions.
And with PPE, I noticed that there was a much shorter life cycle compared to uniforms due to frequency of use and also their limited reusability. So focusing on material choice and recycling is crucial.
Mm-hmm. The biggest takeaway here is that collaborative efforts involving healthcare providers, manufacturers, and hospital staff are essential for reshaping the system.
So as designers, what can we do? How will you engage? What solutions can you propose? Over to you.
Thank you.
Thank you.